Well, first of all, I am very happy to be here, and I'm very happy to be able to talk with a virtual audience. I don't know how many are going to watch the video, but it's really a very happy moment for me because I want to share a couple of my own experience. And but before I do that, I want to introduce myself. I'm a pediatric dentist before I even say my name. And you are going to see in a minute that, why I said, even before my name, why I said I'm a pediatric dentist, because that is going to have a connection of my own journey in a few minutes. Well, my name is Juan Yepes. I mentioned I'm a pediatric dentist. I practice in Indiana. Currently, today, I'm in my practice. And I'm also a faculty at Indiana University, which is about 45 minutes from my private practice. Well, my journey. Remember I said, even before my name, I'm a pediatric dentist. And the reason that I said I'm a pediatric dentist, because believe it or not, for a while, I thought that I never will have a scanner. It was difficult for me, how wrong I was. It was difficult for me to really understand the necessity to have a scanner in a pedio practice. I understand, in a family practice, for a general dentist, obviously for an orthodontist, even for oral surgeons, for periodontists, and but it was difficult for me to really justify having a scanner in my practice, because kind of old-fashioned, using alginate and using compound, and I yes, as a pediatric dentist, I take a lot of impressions for space maintainers. I take a lot of impressions for early interceptive ortho, taking a lot of impressions for doing banal loops and doing lower lingual holding arch and all these things. But I always in my mind was why I need a scanner, why I'm going to invest my money in a scanner if something that that I can still take in the impression with alginate, or my assistant will take the impression with alginate. I was wrong. I definitely was wrong. And really what opened my eyes was finally the day that I, decide, okay, I want to get a scanner. And it just after I got the scanner that I really realized how bad I was practicing pediatric dentistry without a scanner. I get the question all the time from my colleagues, hey Juan, do you think, pediatric dentist, do you think we need to have a scanner in our office? And always my answer is pretty much what I just said. I used to say no, and now in these days, absolutely yes. This is a game change. This is a practice change. It's more efficient, a lot more efficient, and from the patient perspective, a million times better. Remember, we work with the little ones rather than the alginate and the gag reflex, and which was almost daily. I probably have one vomit per week. But besides all these things that is quicker, patient satisfaction, parents love it. Parents will say, wow. Because believe it or not, some parents, they know about the scanners because they go to family practices. They have a couple of crowns, so they experience the dentist working with the scanner. So when they are in a pedo practice and they see that the pediatric dentist is using a scanner, well, they will, this guy is really practicing, state of the art in terms of technology. But besides patient satisfaction, parent satisfaction, your staff satisfaction, because they are the ones, there is also one very powerful reason why scanners are an absolutely tool that you need to have in your practice. The precision, period. I mean, I don't know how many times I will deliver an appliance after taking the impression in the old way, and then the impression will not fit. The impression will need, or my assistant will be chairside half an hour trying to figure it out how to place that appliance. So with the scanner, it's a game change. The quality, the precision of the scanner is Obviously, I probably not perfect, but for me it's perfect. So far, since I'm using scanners, I am not sending back an appliance back to the lab. Labs, they love it because we are connected with the cloud, and our cloud is HIPAA compliant with the lab. So we upload the scanner, is, I guess immediately is on the mailbox of the lab that we use. And then a few weeks later, we have the scanner at our door. And I don't want to exaggerate because it sounds like, okay, now tell us the truth. The truth is, since I'm using the scanner, zero appliances getting back to the lab. That means more efficient chair time, and that means that you can really, because in the old days, I will need to have one assistant for 25 minutes trying to figure out how to adjust the appliance. I think so at the end of the day, and practicing pediatric dentistry for a while and teaching and lecturing around the country and around the world, my own journey about using a scanner in a pediatric dental office is very interesting because I start from a denial. I don't need it. Why? Why I'm going to spend my money in a scanner when I can continue taking impressions with alginate? And then, the day that the scanner came to my office, I realized, I think so the same day, how wrong I was. Pediatric dentistry, without any question, believe me, will have a direct and indirect benefit of having a scanner in the office. Not just only I don't do a lot of inlays and kind of restorations, indirect restorations, I don't do that. But I know some of my colleagues, they do indirect restorations. They do inlays and onlays in pediatric patients, the one with hypomineralization, permanent molars. I don't do a lot of that. But if you have a scanner in the office, it's not just only for your appliances and your lower lingual holding arch, your NANs, your Hyrax, your Vanna loop. It's not just only for that. You can also use the scanner for indirect restorations, which is my next step. I'm ready to do that. I have, and I'm sure you are watching this video, even if you are not a pediatric dentist, I can tell you that you see more often very often, patients with molar hypomineralization syndrome. To number 3, 14, 19, and 30, yellow, brownish, and that doing a direct restoration, doing a composite or doing a filling is not going to stay for a long time. That is the perfect scenario to do an indirect restoration. And guess what? You don't need to take an impression. You don't need to torture the patient taking an impression. You can use a scanner. You can even do the diagnosis of gingivitis using the scanner. It's not crazy. I can look at a scanner. You can look the red. You can look the gums. And they look, believe me, you can see an abscess. Obviously, this is not for the diagnosis of an abscess. But you will see gingivitis as good as with your eyes. Super easy to use. We, here in my office, when we got the scanner, we have a key dental assistant who was the primary, who was originally trained in how to scan, how to upload. She contacted the lab, we create the cloud folder. And then she was the one who trained 2 or 3 more assistants. And then in these days, April of 2025, anybody in my office can scan, and anybody can do a scanner. I know we, in pedo offices, we are not usually very into new gadgets and new tools. Well, scanners have been around for a while. This is not something, but definitely, just to close, definitely 100%, this is a practice changer. It is 100% something that is going to change your practice, is going to bring more patients, is going to give you a good reputation. Remember, parents, they talk in the school meetings, and they ask each other, hey, where did you take your kids to cleaning or whatever? They said, Dr. J, pediatric, that's my practice, Dr. J, pediatric dentistry. And believe it or not, they may say, and he always uses this tool that we never imagined that pediatric dentists will use. So it's good for the practice, it's good for the reputation of the practice, it's good for the patients. No more vomit. We don't need to keep, no more the patient. They love to see the pictures. And yes, I board the plane of the scanners later. I think so they already, the gate agent already said, the gate is closing in 5 minutes. And we pediatric dentists, we are still in the airline club sitting there or whatever. And then we are the passengers who run and jump into the plane just before they close the door. Many other passengers, they were sitting for good 25 minutes. That's the orthodontists, the oral surgeons. But, we pediatric dentists, we board the plane. Now we are in the plane. And I'm just ready I have a couple of more offices, so I'm ready to place scanners in all my offices. In my job at the university, at the hospital, we also use scanners. And definitely it's a game changer. Thank you so much for listening to this video. Thank you so much for taking your time to learn about the scanners. If you are worried about, oh my God, it will take days to learn how to use it, zero. It will take minutes how to use it. Have a wonderful day and thank you so much.